Hi, welcome to Menopause Chicks. This is office hours, and I'm really excited to introduce you to our next guest. Some of you may even recognize her. It's Dr. Shabita Teja. Hi, Shabita.
Hey, hi, Shirley. Hi, Menopause Chicks community. Thanks so much for having me tonight.
Thank
Really
you.
excited to be here.
Thank you for coming back. This is amazing. I know some of our members had the opportunity to meet you back in January in downtown Vancouver. You practice and own Sinclair Wellness. Is that correct?
That's right. Yeah,
Yep.
right downtown Vancouver inside
Downtown
Sinclair.
Vancouver.
Sure.
Who would have guessed that night we were in a room with like 75 women
Yeah,
that what we all had in store for us in 2020?
I know. Never in a million years. This is such unprecedented times. But I'm happy to see you, happy to see that you're doing well. So that's great.
Thank you. And I understand it's also Naturopathic Medicine Week.
It is day two
Yeah.
of Naturopathic Medicine
So
Week.
happy ND week.
Yeah, thank
But I
you.
have to add to, your introduction, you're not only a naturopathic doctor, you're also a
Pharmacist.
pharmacist. Like, how
Yeah.
amazing is that?
Yeah, it's a really great combination because I get to see both sides of the coin, right? I get to bridge the gap between conventional medicine and naturopathic medicine and sort of blend the two to make sure that we're individualizing treatments for that particular patient. And I know for me personally, I needed a blend of the two. So my dad's a pharmacist. It was kind of a natural fit to go into pharmacy with his push, obviously. But I knew that that wasn't right for me. I couldn't see myself just practicing personally. And so when I found naturopathic medicine, I thought, there it is. This is a perfect combination. And I get to take a patient from diagnosis to treatment and actually, work on healing the whole individual and not just compartmentalize systems. So again, for me personally, with an inflammatory bowel disease background, I have chronic pain currently, spinal cord stimulator. I've been through the gamut of testing and many different hospital stays, doctor's visits. So for me personally too, I noticed the benefit of having both types of medicine personally.
Wow, that's incredible. And speaking of whole body wellness, the last couple of times that we have been together, we've kind of gone over hormone health and perimenopause 101. And then I think we quickly decided that we liked one another and wanted to do more.
Yeah.
And you recommended a topic for tonight. So tell
Yeah.
us what that is and why you chose it.
Yeah, so I wanted to dive into gut health and more importantly, the gut brain connection, because I find that that's such an important topic
Yes.
nowadays with that push towards, always go, go, go and fight or flight. And we don't really understand the importance of getting out of that fight or flight and into rest and digest, and how important that is not only for our mental health, our hormonal health, but also our gut health. And my grandfather used to say, every disease begins in the gut. And, he's actually right. So I just wanted to touch on that today because personally, I found that it's such an important topic. Like I said, having ulcerative colitis. But I wanted to share my passion for this medicine and this topic with your viewers.
That's great. And I love the hashtag rest and digest too. I want to
Yes.
learn more about that. Okay, so let's do this. You have identified three things, and I know it's always difficult to narrow these topics down to three things, but three things you want women to know about the gut brain connection. What are they?
Absolutely. So we're going to dive into each specifically, but there are three Ds basically.
Oh,
Okay.
okay.
The first one is diaphragmatic breathing. The
Okay.
second one is digestion and the importance of digestion. The third one is daily bowel movements. And then I will add a fourth one in, and that is to dive deeper with the diagnostic testing. So many D's there, but diaphragmatic breathing, digestion, daily bowel movements, and then if needed, to dive deeper with diagnostic testing.
Okay. So, and when we're finished this conversation, I'm going to add some of those notes to the
Yeah.
comments below this video. So let's do it.
Yeah, absolutely. So the first one, diaphragmatic breathing. Why is it so important? Well, when we look at the gut-brain connection, really what we're wanting to connect between the two of them is our vagus nerve, which is the highway between our gut and our brain. So the vagus nerve is a cranial nerve and it runs directly in front of our body. So when we take a deep diaphragmatic breath, we're actually activating the vagus nerve. And the importance of that is because the vagus nerve directly ties into the parasympathetic nervous system, which is the rest and digest, hashtag rest and digest that I talked about earlier. And when we do that, we're in a state of relaxation, restoration. And when we're eating in that state, we're actually able to fully digest our food. So if you're the type of person that sees undigested food in the stool, if you're not chewing your food thoroughly, if you're eating on the go, then this first point applies directly to you and the importance of taking that deep diaphragmatic breath. So it's just a trigger, it's a memory aid to say, yeah, I actually need to take a deep belly breath. But I'm always, as a nerd, I'm always concerned about the why. Why is it so important? And so when I figured out that connection, that diaphragmatic breathing actually activates the vagus nerve, I was like, aha, that's the reason, that's the importance of it. And so when I see patients in front of me, the biggest things really are stress and digestion that I see time and time and time again. Yeah. So when I'm asking patients, on a scale of 0 to 10, 10 being the most amount of stress you've ever experienced, 0 being nothing, what are you experiencing here sitting in front of me today? And very often it's somewhere in the middle. It's a big range. Sometimes it's as high as a 8, 9, or 10. I very rarely see a 0 or 1. Very right. Few people have low stress.
We would worry about them if they said 0 or 1, right?
Yeah, exactly. So very few people say that. And then you think about we're constantly in a state of this chronic low-grade stress, and then we're eating on top of that. Our body isn't digesting the food because we're in fight or flight mode, and that's sympathetic nervous system mode, which means it's great for when we're being chased by a lion or tiger, and we want blood to rush to our limbs away from our core, and we want to escape, our pupils are dilated. But when we're eating, we don't want to be in that state because there's no blood flow to our core. There's no blood flow to our gastrointestinal system, and that's why it's so important.
So I feel like you may be speaking directly to me and probably a lot of the other women in our community. Yeah. And I say this with a little bit of tongue in cheek. Mm-hmm. Women, myself, we fool ourselves into believing that we're really good at keeping up that pace over and over again. Yeah. Correct?
Oh, absolutely. I mean, what I love about the Menopause Chicks community and what you've started, Shirley, is that you actually tell women, empower them to put themselves on the top of their to-do list, because we're always going, and we're at the bottom of that list. We're doing for everybody else. And what happens is that we're in that chronic state of just chronic low-grade stress. And it might not, it might not injure you in the moment, but over years and years and years of this, the body can adapt to only a certain extent. And very often that's why then our hormones are disrupted. Yes. Our adrenal health gets compromised, yes. Right? Cortisol, biggest stress hormone there is, comes from our adrenal glands. That gets taxed after a certain point. But we don't realize that the gut is so important in that, because we have immune tissue, we have hormonal tissue in our gut, we have gut flora, which is so important for our mental health because there's neurotransmitters being made in our gut. So our gut really is kind of like that main sort of system that has an impact on every single one. So over time with chronic stress, it will impact all of our systems, especially the gastrointestinal system.
Yeah, and I think the thing that worries me the most is that when we are really good at keeping up that pace, that chronic pace, as you refer to it, is in our 30s and 40s.
Yeah.
But when do the chronic conditions show up? You're right. So it's our mothers, our grandmothers, it's ourselves. Maybe we're suddenly being diagnosed with things that we just never thought we would have to deal with in our lifetime. And
Yeah.
if you can, it's really hard to do on your own life, but if you can have sort of that 30,000 foot view of,
Yeah.
oh, look at the pace that I was going at.
Yeah.
Like for me, the pace was my late 30s, early 40s. It was like young kids running a business, taking care of aging parents, all of those things where you just have your foot on the gas pedal all the time.
Yeah.
Right. So, yeah, I don't know. I mean, I don't know that I've learned my lesson, but I do love to talk about it and think about it. And can we just back up and make sure that everyone understands what kind of breath you're talking about?
Absolutely.
You can
So
demonstrate.
yeah, so when I'm talking about a diaphragmatic breath, let's distinguish it from a chest shallow breath.
Oh,
Many of us are shallow breathers,
okay.
right? So you put your hand on your chest and another hand on our belly, right? If our belly here, belly button. You want to take a deep breath in through your nose. Now, what rises first? Is it the hand that's on your chest or the hand that's on your belly? Very often it's the hand that's on your chest. That's
That's what we're
taking just
taught.
a shallow breath. Now I want you to activate and lift up that bottom hand, which is on your belly. So try that again. Deep breath in through the nose and exhale. So your bottom hand should lower and then your top hand should lower. So that when I'm saying a diaphragmatic breath, what I'm talking about is activating that bottom hand on your belly button essentially.
Okay.
And as women, we're often told to, suck in our gut, correct posture. We don't want that belly to show. Well, actually, a deep diaphragmatic breath means that belly is pressing out. Because when we're pressing out against that hand, or imagining our hand on our belly, we're actually then activating the vagus nerve, and that's what's so important about getting into rest and digest. So it is sort of we have to retrain our brain.
That's a really good reminder. So, is it your expectation that we set time aside to do that exercise, or are you suggesting that this is something that we do, on autopilot?
No, I think you really do need to set time aside, especially at the beginning, because this is not going to happen just
Yeah.
overnight, right? So sometimes reminders on your phone, or if you have a meditative practice, not everybody does, but
Yeah.
maybe it's, 30 seconds, you're working up to 2 minutes and then 5, and then beyond. That's the time to take those diaphragmatic breaths. And then especially before meals. So anytime you're placing something in your mouth, it can be a memory aid to say, let me take, 5 diaphragmatic breaths before eating, because that's what's most important, right? You want to get into that parasympathetic, calm, rest and digest state. The blood flow is going to your core, going to your digestive organs, and then you're able to digest appropriately and completely, because that's the most important thing.
That's a wow. That's a huge wow for me. I mean, my grandmother was, had a lot of religious practices, and I grew up saying grace before every meal. We
Same.
don't do that. We don't practice that anymore.
No,
There's the purpose of it or the benefit. Oh my gosh,
absolutely.
thanks.
Yeah, yeah, I think it's really important, especially, I mean, the state that we're in when this recording happened, we're in the middle of or I guess phase 2 of the pandemic with reopening. But during the actual stay-at-home orders, a lot of us actually had time, forced time to connect with our families, forced time to, enjoy meals, cook meals for the first time in maybe years. So it is a good reminder, especially now that our globe is actually being forced to take a reset.
Very cool. Okay, I could talk to you all night, but I'll try to keep the agenda going. What's number 2?
So number 2 is I'm actually going to go to daily bowel movements, and then we'll talk about the importance of replacing insufficient digestion, because that's really number 3. So number 2, pardon the pun, I guess, number 2, daily bowel movements. And so daily bowel movements, how many of you hearing this right now are thinking daily bowel movements? That's not me. So many of my patients, again, I ask about stress, I ask about digestion, 2 really big things. So when I'm asking about digestion, I'm asking about their bowel movements. We go right in, and I, try to warm the patient up a little bit, but I talk about this every day, all day, so it doesn't faze me in the slightest. I want to know about your bowel movements because I want to know how you're eliminating.
Okay.
And when I see how you're eliminating, I actually learn a lot about your hormone health, the stress that you're under, how you're digesting, how you're absorbing, nutrient absorption. So I learn a lot. So daily bowel movements is actually considered quote unquote normal. Actually, 1 to 3 bowel movements a day is considered normal. If you're eliminating after each meal, you're doing fine. If you're eliminating once a day, you're doing fine. That's normal. If it's less than that, you are considered constipated.
Right.
And how many of that, when I tell that to patients, it blows their mind because they often go once every 2 days, once every 3 days, and that's normal for them. And I know that something's not right there. So daily bowel movements is very important. And I will say that there's a chart online. You can go to Bristol Myers chart. That's a stool chart. Okay, so you're familiar with that.
I am, but I'll post a picture.
Okay, awesome. So what I do is I show that chart to my patients and I say, what does your stool look like? Because it's a range, right? Usually around 3 to 4. Usually 4 is normal. It should look, like half a banana, easy to pass, formed. There should be no blood, no mucus, no undigested food. I mean, the occasional corn is fine. But that really is, again, quote unquote normal. And I say quote unquote because there's always caveats to that rule. I mean, if you have inflammatory bowel disease, if you've got irritable bowel syndrome, SIBO, small intestinal bacterial overgrowth, there's lots of caveats to it, but in general, that's considered a normal bowel movement. So that's very important, and that's why that's our number 2.
And then you work with women to close the gap between current and optimal, correct?
Absolutely, yeah. So we close the gap by addressing not only their stress, because that's a big part. In naturopathic medicine, the beauty of it is that we're looking at the whole person, right? We're looking at mental, emotional, and physical health. So we go into all of that, but I'm really looking at, what does your digestion look like? Is there insufficient digestion? Are there foods that you're eating that are causing sensitivities that your body's reacting to? And then we want to repair gut lining. So very often there's an underlying leaky gut. And so I can expand upon this a little bit more because not everybody is familiar with leaky gut syndrome. And so we want to repair that by repairing the whole gut lining. And that helps to take us from their current state of not optimal digestive health and not optimal bowel movements to an optimal state.
And then just describe the benefits of that optimal state. Let's give everyone watching a dangle of a carrot for them.
Yeah, absolutely. So like I said, the gastrointestinal system is sort of that main hub. There are neurotransmitters being produced. About 90% of your serotonin, which is your feel-good hormone, is produced in your gut. So right there, that's a big, gut nervous system, gut-brain connection right there. We've got our optimal flora, right? Probiotics, the importance of it, the balance between good and bad flora in our gut. There is a portion of our microbiome, so that's the bacteria in our gut, the good bacteria, that actually is responsible for estrogen production, estrogen metabolism. So if, women listening to this right now are suffering with poor hormonal health, or they're in perimenopause and haven't addressed their gut health, that could be something right there that should, be something that you're thinking of right now. If you're listening to this right now, thinking, yeah, I'm not having daily bowel movements and I'm suffering through perimenopause, which you shouldn't be. So there's lots of cross-sectional impact to that gastrointestinal system, your nervous system, your hormonal system, and then your immune system. We've got gut-associated lymphoid tissue, so GALT. That is a little part of our immune system that's in our gut. And that's why it's so important to have the proper, fermented foods, probiotics, taking care of our gut health, because it has an impact on our immune system. And so that's the importance of taking care of your gut health, because there is not only a gut-brain connection, there is a gut nervous system, gut hormone connection, gut immune system connection. So our gut really is our hub.
Yeah. Well, this is a huge conversation. And if you're, fortunate enough to work with a hormone gut health detective like Dr. Shabita, it can be very personalized. But for me, like even the reminder about serotonin, and we think about women who are maybe challenged with mood changes and haven't yet drawn the connection between, and I'm just going to be really extreme, like drive-through takeout food and coffee, and not feeling like yourself anymore. I mean,
right.
It sounds obvious when we lay it on the table right now, but for many women who are, as we mentioned, just pushing the gas pedal, just trying to get through the day, just trying to get their kids to all, pre-pandemic or post-pandemic sporting events, just doing what they can. The food that we eat is just not enough to sustain those good moods that we all crave.
Oh, absolutely. And you touched on such an important point, the mental health. And really, it's a mental health pandemic right now. There's more light being shone on this, which is so wonderful and so important.
Yeah.
But there is such a big connection to our gut health if we are suffering with anxiety, if we're suffering with depression. And I mean, it doesn't have to just be diagnosed anxiety or diagnosed depression. Maybe you have, just underlying low mood, or you've had maybe one panic attack and hate that feeling and never want it again. Look at your gut health, because there is a connection there. Again, 90% of our serotonin, that's our feel-good hormone, being produced in our gut. So if we're having foods that our body is sensitive to, so food sensitivities, for example, say, it's sugar, or it can be something healthy like chickpeas, for example. I've had so many patients that it comes up on their food sensitivity test results that they're allergic to peas, chickpeas, yeast, cow's milk, dairy, egg yolk. And then when they eliminate that, they're starting to improve, not only with gas and bloating, but their brain fog improves, their fatigue improves, and that underlying low mood also improves. And I've seen that in many cases. So it's not just a few, it's actually several. Because what's happening there is that every time we're putting in something that our body deems as non-self, so meaning that it's a food sensitivity, your immune system's reacting to it, because we have leaky gut then, and our cells lining our gastrointestinal system aren't tightly knit together. Over time, with stress and toxins, bacteria, viruses, the cells lining our GI system become leaky. And so then when our food is digested, it actually seeps through into our bloodstream. And then our immune system gets activated, thinking that this shouldn't be there. And then we get symptoms that can be not just gas or bloating. It can be, I call this head to toe symptoms. So brain fog, fatigue, rashes, gas, bloating, like head to toe. Really.
Wow.
Yeah. Wow. So it's very important to determine what foods you're sensitive to. And that's a difference between food allergies. That's not what I'm talking about, but food sensitivities.
Okay. What would you like to tell us next?
Yeah. So then let's talk about replacing that insufficient digestion.
Okay.
Right. So one of the first things we learn in naturopathic medicine really is healing the gut. The 4 R's to healing the gut. So we want to really remove, the first R is removing the food sensitivities, removing those irritants. So whether that, and really that can be stress, anything that's going to impact the gut lining, like I talked about. So, but really let's talk about food. So removing food sensitivities, whatever that is for you. I'll tell you the big ones, which we all probably know: caffeine, alcohol, yeast, sugar, dairy, gluten. Those are the big ones. I know, the most fun that we have. I'm telling you to take away everything. No, I'm totally kidding. But it's not sensitivities for everybody. So you can either do an elimination challenge diet, where you go on a hypoallergenic diet and slowly introduce one food group at a time,
Right.
to really see how that particular food is impacting you. Or you do a food sensitivity test, it's just a blood test, and you get a report like I referred to earlier, where you get a list of your elevated, borderline, and then normal foods. Foods that you're fine with, the borderline and elevated are ones that your body is reacting to, your immune system.
Okay.
So you want to remove those foods.
And some of those sensitivities or borderline foods, they are for you right now at this moment in this state. That might not be a forever.
Exactly.
Right?
Very, very good point. Yeah.
Okay.
And that's such a great point and such an important question, because that's what I get asked time and time again. Is this a forever? And no, it's not a forever. Food sensitivities, unlike allergies, really do change over time and can change within 6 months. So it depends on where you're at right now. And that's, so it's not a forever. Usually I say to remove the food sensitivities for about 2 months.
Okay.
2 to 3 months, depending on how sensitive you are, how extreme your situation is, how severe your symptoms are. So it's not a forever, and then you're slowly introducing one food group at a time.
So we can look at it as a short-term investment.
Yeah, exactly.
Right.
Absolutely. Yeah.
Long-term gain. Okay.
Yeah. So that's, so when we're talking about, replacing insufficient digestion, that's actually the second point here. So we're going to remove the irritants, then we're going to replace insufficient digestion. So what I mean by that is, how is your body's own digestive enzymes? So remember I talked about rest and digest, chewing our food thoroughly. Our digestive enzymes are activated in that environment. And usually it's activated in an acidic environment, which is why your naturopath might recommend a bitter tonic, a bitter herbal tonic, or apple cider vinegar before meals, because that's replacing or reactivating your body's own digestive enzymes. Okay. So you can either do it that way, or you can actually take a digestive enzyme supplement. So you're actually really then replacing your body's own digestive enzymes because it's not sufficient. And clues that tell me that you need this are if you're getting a number of undigested foods in your stool, because that really tells me that you're not appropriately and fully digesting your foods. Okay, so that's a digestive enzyme and replacing insufficient digestion, whether that's apple cider vinegar, digestive enzymes, herbal bitters. Then we want to re-inoculate the system with good flora. So kind of what we talked about earlier with probiotics, fermented foods. We want to have a good balance between that negative or bad flora and good flora. So that's the microbiome, right? That's what we're talking about when we say trillions of bacteria in our gut. What is that balance? Because there's pathogenic bacteria. That's like, Candida is a type of yeast. There can be an overgrowth, and then we get symptoms, brain fog, extreme sugar cravings, weight loss, gas and bloating. So if there's an imbalance in the good versus bad flora, that's when we get symptoms. So we want to make sure we're re-inoculating the system with good flora, either through probiotics or through fermented foods. Okay. And then we want to repair the gut lining. And that's similar to what touching on the point about leaky gut. So if the cells lining our gastrointestinal system are leaky, how do we heal that? Well, we heal that by giving the body the supplements, the amino acids, the food it needs to help stitch that gut lining together so that there is an even layer and food isn't seeping through into the bloodstream. We do that with, a number of supplements. The main one really is L-glutamine, which is an amino acid, which is actually food directly for our large intestine. and it helps seal those cells together.
Okay.
That is replacing insufficient digestion. And that's why I put that as a third D, because that's such a big topic. But really that's replacing any type of insufficient digestion that I discussed. And it can be one of the 4 R's.
Okay. So I try to encourage women to, do this under the guidance of their healthcare professional. But are there any elements to what you just described that we can be doing on our own? Like, should I just always be taking a probiotic, for example?
No, and I think it is so important to, do this under the guidance of a healthcare professional, obviously, because like I said, there can be caveats, right? If you have small intestinal bacterial overgrowth, where bacteria are actually now moving from the large intestine to the small intestine, we don't want to add probiotics at that point because we're just adding to the overcrowding.
Okay.
Right? So it's not an always situation.
Okay.
But what you can do is get more into the body, figure out what foods aren't suiting you. And I would say this you can do without a healthcare professional right this minute, is keep a diet diary. This is one of the first things that I tell patients after our initial 60-minute visit. Keep a diet diary. Not only write down whatever is going into your mouth, so food, drinks, and otherwise, but write down what symptoms you're experiencing. Are you having gas or bloating? Are you feeling really fatigued that day, difficulty sleeping? Write it all down, because I guarantee you'll be able to make a correlation between foods that you've eaten and a few hours later, a manifestation of the symptoms that you've come into the office with.
Okay. All right.
Anybody can do that.
Okay. Awesome.
Yeah. Okay. So that's basically our 3 Ds. How many letters are there? 3 Ds and 4 Rs now. So okay. I've given you lots of pointers. And then the last one, really, that 4th D that I talked about earlier, was diving in. So it's digging deeper, right? Digging deeper into diagnostic testing if none of this is working. And I say that because it's not always something that you have to jump into right away. I understand that, even seeing a naturopath is expensive. These diagnostic tests are expensive. So sometimes even, like I said, just starting with the diet diary that takes, $0, doesn't cost you anything to see anybody. But if you have been suffering for a while and you have done all of this and there's still nothing's adding up, nothing is improving, the needle isn't moving, then you might want to look at some diagnostic tests, and they can be very, very helpful. And the one that I'm thinking of, besides a food sensitivity test, is a comprehensive digestive stool analysis. So we call it the CDSA. And that really is just one stool sample. You send it away, usually about 6 to 8 weeks later. I get a report that I then share with you that looks at what does your flora look like? Where, if any, are there pathogenic bacteria, yeast, fungi, worms in your system? And then what I love about these tests is that it actually shows us what natural agents and what conventional medicine these pathogenic bacteria, viruses, yeast are sensitive to. So for example, remember I mentioned Candida? I have a report then that shows this patient's got an imbalance in their flora. They've got an overgrowth of Candida, and these are the agents that this Candida is sensitive to. So for example, berberine or caprylic acid, or like fluconazole, so actual conventional medicine. And then it takes the guesswork and heartache out of guessing and testing and trying one treatment after the other. I know exactly that this patient has Candida and this will be effective for this strain of Candida. So it's a very comprehensive, like the name suggests, stool analysis, and it can be very helpful for patients that have suffered and just, have run out of ideas. It can be very helpful.
Awesome. So you call it diving in. I usually refer to it as peeling back the layers of the onion.
There we go. Exactly.
Right? Like just searching for the root cause And I think that part of the conversation that we can wrap around that is
Mhm.
that you're worth it.
Yes.
Right? Like we
I
have
love
so many women who suffer for a long time and try lots of different things. And until we can actually peel back all the layers of the onion, um, you're eventually going to get to your quality of life, which you absolutely deserve.
Absolutely. I love that so much because it's so true. And different layers of the onion happen at different times, right? Different things can manifest. Maybe you've got, kids that you're carting around everywhere and driving to different activities. The next layer of the onion might be looking deeper inside yourself. What do I really want now that my kids are grown? So different stages mean different things, when you're looking at the onion. So it's very, very important and very true. And it kind of comes back to what your mandate is to get women to put themselves at the top of their to-do list and start peeling back that onion for yourself right now, because there's many layers. And that's, like I said, the beauty of naturopathic medicine is that we're looking at the mental layer, the emotional layer, physical layer, tying it all together to make sure that we're treating you as the individual. And that's why no two treatments really are the
Right.
same. This is a generalized topic, but when you
Right.
come in to see a naturopath or another healthcare professional, hopefully you're being treated as an individual and saying that this is right for you at this particular moment.
Love it. Love it. Love it. I think that you've given us lots of nuggets and a great overview to get started so that we can, if we don't already have a naturopath on our team, we can consider, expanding our health team. And this is one of the reasons why you would want to. So, Dr. Shabita, I'm going to ask you a question that I ask a lot of our guests on here, and that is just in summary, what is the one thing you want women to know about the gut brain connection?
The one thing that I want women to know about the gut brain connection is the importance of restoring their own nervous system away from sympathetic dominance. So, what we talked about earlier is that relax is really that fifth R.
Hmm.
So when we're talking about repairing the gut, we want to relax our body and move it out of sympathetic dominance, meaning out of fight or flight, before we're sitting down to eat, before we're putting anything into our body, because that really is so important for complete digestion, complete nutrient absorption, but more importantly, that should seep into many different aspects into that woman's life, that they're taking time for themselves, that they're not always on the go, and that they're actually putting themselves first. So really the gut brain connection can kind of tie in very nicely to putting ourselves on the top of our to-do list, relaxing, getting out of sympathetic dominance, putting ourselves first, because really when we do that, we absorb what we're eating, and we're putting the right fuel into our body so that we're not just existing, we're actually feeling vital and living a life of vitality. I always tell my patients, you can either exist
Hmm.
or live a life filled of vitality, and that's what we want.
That's very inspiring. Thank you. And I am your target audience. I needed to hear that today. So
Oh,
thank
that's
you.
so great to hear. Thank you for having me. I love talking to you. I could talk to you for hours.
Yeah.
And yeah, I really love what you're doing with Menopause Chicks. And thank you for inviting me to be a part of it tonight.
Well, same. We're really proud to have you as part of our team. I know it's been a very crazy few weeks leading up to our conversation tonight, and you're in the midst of reopening your practice. So
Yeah.
please take care of yourself as well.
Thank you so much, Shirley. You as well. Stay safe, stay healthy, and to everyone, stay optimistic. We'll get through this.
That's awesome. Thank you so much.
Thank you, Shirley. Bye.